during the last months, still today, we have to struggle with this issue of this COVID-19 pandemic. So this is a real problem, and this is associated with the high morbidity and high mortality in patients with hematologic disease. This is a result we see in the first report with few patients that have been confirmed recently with the paper published in the Lancet Hematology from the Italian group with a very high important number of patients that also report a mortality between 30 and 40% of the patient with hematologic disease. And in particular, patients with multiple myeloma are at a particularly high risk to have some severe COVID-19 disease because they are highly immunosuppressed, they receive a lot of steroids. Therefore, we have to be very cautious and we have really to decrease the risk of COVID-19 in those patients. So what we can do and what we are doing is that we try to reduce the frequency of the inpatient visit of the patients, because you know that they have to come to the hospital to receive the chemotherapy, but sometimes some chemotherapy that require to come 2 days at the hospital, we can give it only on 1 day. There is also some drugs that we give IV or subcutaneously. We can use some other drugs that we are going to give orally. What we can also do is to be very cautious in the management. When patients come to the hospital, we have to check from fever, to check if there is anything that where we are going to suspect COVID-19, and in this case, we are going to isolate these patients, not to expose other patients. And another question is what we are going to do about autologous stem cell transplantation. This is a very important treatment for multiple myeloma. In some, because it exposes the patients to require intensive care, and in some centers, intensive care were not available because it was only for patients with COVID-19. So it is also questionable to delay autologous stem cell transplantations, also to give some triplet induction regimens up to 8 cycles. And after, if you are able to do the autologous stem cell transplantation, you do it after the 8th cycle of induction chemotherapy. Or if the patient is in complete response, you can go proceed to the maintenance regimens and give the autologous stem cell transplantation as a second-line treatment to the patients.